Hello, my name is Niloofar Sina and I'm PGY1 Anatomical Pathology Residency at University of Toronto. The topic of the article that I recently got acceptance for is Pitfalls in Diagnosis of Lentigo maligna melanoma, Facts and an Opinion. And it was published in British Journal of Clinical Pathology in October 2020. Before going to more details about this article, I have to give an introduction about why I chose this topic. I was a practicing dermatologist before moving to Canada, and then I did a fellowship in dermatopathology with my mentor, Dr. Danny Gazarian, and my other supervisor, Dr. Zaid Saeed Kamil, at Toronto General Hospital, University of Toronto. Almost at the end of my fellowship, my mentor suggested writing about this topic, and I found it as an appreciation of what I have learned from them and my experience of fellowship with them, because we had a busy service in dermpath, and especially a considerable amount of cases that we received were gray areas of pigmented lesions because of the high reputation that our service had about melanocytic lesion. And whenever I had a challenging case, I used to read about in different books and references and articles, but always I found their experience very helpful in guiding the diagnosis. So for writing about this topic, I went back to the logbook that I used to keep about my challenging cases, and I picked few good photos from our archives. I started writing the primary draft, and it was almost in my few weeks of starting residency. They edited the primary draft for me and they chose me as a corresponding author. So I started communication with the journal, and the whole process was a great experience for me. Especially I learned that the highest effort that I put in my primary application would help me to receive less critics in the future. And it was an easy process to get the acceptance after that. And hopefully a whole experience would guide me in my future research projects during my residency. Thank you.